Life on the streets of the Bronx, especially difficult for those living with addiction. For Kungasherta, it cost her her connection to family, and she felt stuck in a cycle that seemed impossible to break.
Well, I've been here in the Bronx for about the last 3 years, right? And I would just stay here and just not go home,
But for Kunga and others like her, hope arrived thanks to the Harlem United Mobile Support Unit, funded by New York State opioid settlement dollars. Every week, the van hits the road, bringing support and supplies to people, meeting them wherever they're at.
So we really wanted to create a very harm reduction, low threshold approach to engage people who are using drugs really where they live in the moment. So we started this program based on kind of taking the medical care to them on the streets. When did you start using opioids? Were you 11?
Judith Cole, a nurse practitioner and program director, says before the van was available to them, they walked the streets with backpacks of supplies, meeting people under bridges, in alleys, literally meeting them where they were at. Now they can reach even more people, building trust and offering immediate care, including prescriptions for addiction medications like Suboxone.
Well, I can send the prescription, I can do the wound care, prescribe antibiotics, and do all of the things that maybe they wouldn't be able to get right on the street in the moment. And for a lot of people, I'm the only provider they see.
Hi, how are you?
So a lot of this is also about establishing trust, again, with the healthcare community.
Syringes, smoke kit, one Narcan.
Tamara Epps is a volunteer with Harlem United and says the van removes barriers to connections and services and helps people stay safe and healthy.
And we also have the flyers, so we'll tell them they can come to the office and they can see the doctor, or they can come in the office, they can wash their clothes, they can take a shower, they can just relax, catch some AC, so a whole bunch of stuff.
Connection, right?
Yes.
For Kunga, the impact has been life-changing. The Suboxone provided by the mobile unit and made possible with opioid settlement dollars helped her manage her urges, enabling her to make significant change, leading her to recovery and reconnection.
Yeah, no, it's definitely got better. But now that I've started back on medication, I don't use as much, they're much more open.
Today, Kunga is no longer staying on the streets. Thanks to the services she received, she's living a healthier life and back living with her family. If you'd like to learn more, visit oasas.ny.gov. And if you or a loved one would like to talk to someone about support and services right now, you can reach the Hope Line at 877-8-HOPE-NY or text 467-369.